morning, everyone. My name is Samara Mahindra, and today I'm going to talk to you about the big C, cancer. Cancer is a word that is highly stigmatized in our country and comes associated with immense amounts of fear. But when it comes to cancer, knowledge is power. And I truly believe that this fear comes from a lack of knowledge. Now, why am I so interested in cancer? Apart from the fact that I believe 1.46 million new cancer cases are being diagnosed in India yearly. And unfortunately, 1 in 9 Indians will be diagnosed with cancer. But it's actually because of her. This was and is my mother, who was diagnosed with cancer in 2004. We went through a long, treacherous journey of treatment and cancer treatment side effects for many, many years. Hospitals became our second home. Doctors became a part of our family, and cancer became a part of our lives. Now, my mother, I have to mention, was a very strong, dominating, independent, extremely successful businesswoman. She called the shots. She was the breadwinner of the family. And to see someone like herself crumble into being so dependent on other people just because she was not able to tolerate the side effects of her disease any further broke our hearts. Now, we had access to great medical care, and we were always fortunate and grateful for that. But I remember one day thinking, do I rather have stable medical reports or my mother back? A question I still ask myself every single day. In 2010, unfortunately, we lost her, but that's when my journey with cancer began. I couldn't fathom the fact that we had access to great medical care, but why was quality of life diminished to such a degree? Why couldn't we tolerate the treatment side effects? And why couldn't we live normally while we went through this journey of cancer? I got exposed to this world of integrative oncology, and that's when we decided to build a program, a company, a protocol that integrates conventional cancer treatments with other non-clinical therapies to improve the quality of life of cancer patients. And we then launched the first evidence-based integrative oncology protocol in India. Now, what is integrative oncology? It's primarily using mainstream cancer treatment, which is your chemotherapy, your radiation, your surgery, hormonal therapy, immunotherapy today, along with evidence-based non-clinical therapies, lifestyle modalities to help patients heal better, tolerate the treatment side effects, and improve quality of life. There is immense amounts of scientific evidence of how this approach has had an impact on patients' quality of life improving, responding to treatment effectively, and also on impact on survival and risks of relapse. But what is a part of integrative oncology? What are those lifestyle modalities? Nutrition, now known as the 5th pillar of treating cancer. The food we ingest is essential to our well-being, and for a cancer patient, even more so. Unfortunately, cancer patients experience multiple nutritional deficiencies that can only be managed through a personalized nutritional intervention. The side effects that cancer patients experience, nausea, vomiting, weight fluctuations, loss of appetite, can all be managed through the right nutritional regimen delivered by trained clinical medical nutritionists. Last but certainly not least is gut health. Your gut is the foundation of your health. It's where we absorb and assimilate nutrients. And unfortunately, with cancer treatment, it really has a negative impact on gut health. So, what are the foods that a cancer patient who's going through treatment and post treatment can consume? Foods that are rich in probiotics, that actually enhance gut health, that repair the gut. Probiotic foods include dahi, yogurt, lassi, buttermilk, dhokla, idli, dosa, any fermented foods, sauerkraut, tempeh, kimchi. There are multiple that we can incorporate in a cancer patient's diet plan to improve gut health. Prebiotics. These are foods that actually feed the probiotics. These are foods like onions, garlics, bananas, flax seeds, so on and so forth. And all of this makes a personalized, enriched nutritional regimen for a patient to manage the nutritional deficiencies and the side effects of cancer treatment. Second is movement therapy. Unfortunately, cancer patients also have a lot of physical discomforts, fatigue, weakness, pain, lymphedema, which is swelling of the limbs if there has been a lymph node removal, neuropathy when there is numbness in the fingers and the toes. All can be managed by a tailor-made movement therapy regimen by trained physical therapists. These can really help patients improve their quality of life and get them through the treatment faster. Now, majority of the time, patients feel a lot of fatigue. And we often think that, if there's a lot of fatigue, then maybe we shouldn't move at all, which is actually contrary to the truth. Some amount of movement actually initiates and releases endorphins, which increases energy in the body. So movement for cancer patients is essential. Now, what kinds of movements? Yoga therapy is profound. It has a huge impact on the physical well-being of a patient, but also mentally. Any type of light movement exercises, walking, or anything that is not too strenuous, some light strength training exercises, because muscle atrophy is also a very big problem when a patient is going through cancer treatment. But to incorporate a strong exercise regimen for patients has a massive impact on how patients heal from the cancer and the cancer treatment. And last but certainly not least, according to me, probably the most important is mental well-being. With a cancer diagnosis comes immense amount of emotional and mental distress. Stress, anxiety, depression, fear for your life, fear of a cancer recurrence. This is all very common for cancer patients and for caregivers. We have to help patients and caregivers manage these emotions. We have to help them manage stress better. We can't eradicate stress. In fact, I think a little bit of stress is motivational. It's good. But chronic stress over a long period of time has negative physiological impact and should be managed effectively. Guided meditations are wonderful. It creates a restful state for the patient as well as for the caregivers during them doing the meditation and beyond. Counseling, speaking to a professional, speaking to clinical psychologists, to give them a platform to express themselves is also extremely beneficial, where psychologists have the opportunity to share with patients and caregivers on tools and techniques on how to manage various types of emotions that they might be feeling. And community-based support. Talking about cancer is essential. We need to normalize the conversation with cancer. We need to talk to other cancer patients, other cancer survivors, caregivers, which can be extremely empowering and help patients get through this journey. We work with thousands and thousands of patients, and I have personally witnessed patients who have had stable medical reports, but have completely lost hope in their journey to fight cancer. And unfortunately, over time, I have seen those reports decline. So mental health and mental well-being is probably one of the most important ways of treating and healing cancer. So what is the impact of an integrative approach? It reduces the side effects of treatment, it improves the response to treatment, it improves quality of life, it increases adherence to the treatment, it expedites healing and recovery, and it improves overall health outcomes. So what is the future of cancer care? The future of cancer care is a multidisciplinary approach where we integrate conventional forms of treatment along with evidence-based lifestyle modalities in increasing and improving the outcomes of cancer patients and cancer survivors. And I want to leave you with this quote. Only 5 to 10% of all cancer cases are attributed to genetic defects, while 95% of cancer cases are linked to environmental and lifestyle factors. 90 to 95% of cancer cases today are linked to environmental and lifestyle factors. Thank you.